Good evening, Los Angeles, and thank you again for joining me tonight here at City Hall. The chapters of American history are written by us all. When we are students in high school, we page through them to see the moments in our history when the greatest challenges have come to us and where we have risen to those challenges. These days, it feels like it's one giant run-on sentence, a life unpunctuated by the normalcy of a weekend and a weekday starting, except for the critical workers that are still going to work each day, and even for them, the weekends have disappeared. We know that life feels different. It feels all of a sudden like nothing is the same. We have no periods to stop, no commas to pause, fewer exclamation points to celebrate, maybe a lot of question marks for what comes next. But I want to talk to you today about this moment and this chapter in American history, because you might not have noticed in this new normal some of the things that go by, and today is Cesar Chavez Day, a day which marks a great American who stood up for the rights of all America and who pushed forward who we are as a nation. It was in the 1970s that Cesar Chavez was together with Dolores Huerta and the other leaders of the United Farm Workers Movement in Arizona. And there, where they were trying to have the most basic right to be able to strike and to be able to, of course, stand up for themselves, they were being beaten down by the system officially and physically. It was then that Cesar Chavez started what became a 25-day fast with nothing more than water. And at the end of those 25 days, he was hardly a man anymore. He had to be hospitalized. And Dolores Huerta visited him and then spoke to the farm workers who saw how beaten down Cesar was, but how courageous he had been too. And they said, "We can't do this. No se puede. It's not possible." They had a governor who refused to sign a law, in fact, signed one eliminating their right to have any basic worker rights. And Dolores looked at those workers and said, sí se puede. Yes, it is possible. Yes, we can. And now in America, this is part not just of that chapter, but of the American fabric. There are days right now where we wonder, it can't be done. Is it possible? And many of us feel in our hearts, no se puede. But I want you to feel and to know that, of course, not only can we do this, we will do this together. And that tonight, as we remember him and the living legend of Dolores Huerta, who still lives here in this great city and in California, that each one of us has a role to find that same courage they summoned to get through these days together. This was the start then not just of any week, because this is not just any week in American history. This is a defining week in our history, a critical week in our future. And what you do, you are one of the authors of those pages that we will look back on with the success that we can achieve together. The more we do, the quicker this will end. The less we do, the longer it will take. And we know the longer that it takes, the more people will lose their lives, and we know more damage will be done to our economy. We can each do our part, and we are in this together. So tonight, let me bring you up to speed where we are and where we're going in our fight against COVID-19 in Los Angeles. Share the data and the numbers that you need to know, then announcements on new steps we're taking to save lives, and finally, new information on programs already in place. Let's begin with tonight's data snapshot. Today in Los Angeles County, it was announced that 342 more confirmed cases of coronavirus brought the total cases to 2,474, a 16% increase over yesterday. In the city of Los Angeles, there were 151 new cases, bringing the total to 1,171, also a 15% increase. And additionally, there were 7 more fallen. Deaths added, bringing the total to 44 and 19% increase over yesterday. The number of our dead have now doubled over the past 4 days. To each family, to each Angelino, to each friend, each mother, each daughter, father, son, sibling who's lost someone tonight, we stand with you. We cry alongside you, and our hearts break with you as well. We continue in Los Angeles to increase our testing capacity, and as of this afternoon, we have administered through the City of Los Angeles' testing program by our fire and personnel departments. We've completed 8,373 tests. By the end of this week, we'll bring that pace to 13,000 tests a week, and nearly 20,000 tests done by the end of this work week, or one for every 200 LA City residents. And today we opened a 5th testing location, and our combined locations filled nearly all 2,300 slots available. Starting tomorrow, we have 2,500 slots. So please, if you need a test, go to coronavirus.lacity.org to see if you're eligible. And we're working with UPS and Everlywell to add another 2,000 tests a day. So the pace continues to quicken. We continue to push to allow more people to not only get tests, but to inform our public health officials about those results so that they can contact those people and talk to their contacts. As I shared with you yesterday, it's not just the physical distancing, it's the isolation and the quarantining that is a critical weapon in the days ahead. If slots are filled on any day, the system now will push you to the next day or to a future date that works for you. And we continue to do everything in our power to address the health and safety needs of Angelinos, no matter whether they're housed or whether they're homeless. In fact, we've opened 13 now emergency homeless shelters at our Rec and Parks facilities across the city. And tonight we're at 95% capacity at these sites citywide. And I thank the Rec and Parks staff who have helped get these shelters up and running in record time. One of them passed on to me a story that one of the residents of the shelter said. He said, "I know this virus is supposed to do something bad to all of us, but it's brought me indoors where I can finally stabilize my life, eat something, be in a safe environment, make sure that I won't be overtaken by this virus." Whether you're housed or homeless, we're going to do everything we can to make sure that you are protected, that we face this together, and that we realize all lives are equal in this city. Along those lines, too, emergency shelter beds that we are setting up in those rec centers are in addition to more than 900 motel and hotel rooms that the state, our Homeless Services Authority, and county partners, together with the city and other cities, have secured for isolation and quarantine. So far, more than 150 motels and hotels across the county have inquired about this effort and are being assessed as we speak, 150 different buildings. And I want to repeat my call to any hotel or motel willing to step up and join us. If you have rooms that you want to spare and want to help, tell us at coronavirus.lacity.org/rooms. And last night, I shared a little bit about the trailers that the state of California is producing, adding critical new capacity to our shelter sites, providing a place for people to go when they begin to show symptoms or if they need to be quarantined or isolated. And I can report that the first 42 of those trailers have now been delivered to the Westwood Recreation Center and will be set up with utilities this week. The next group of 27 will be placed at the Granada Hills Rec Center by Wednesday, and these trailers are critical to stopping the spread of COVID-19 and saving the lives of Angelinos. With every day of new changes, we see new patterns and we see new data emerge. And one of the things I wanted to share with you today, with fewer people out and about, fewer cars on the road, our emergency personnel are responding to fewer traumas. That's also freeing up badly needed trauma beds in our hospitals. But what I learned this weekend too is that the accidents that are happening, from those of you who are still out on the road, that unfortunately those have been horrific. People are speeding, people are going too fast. I know for those who have to drive how amazing it must feel to be on these streets. It's like you rewound the clock by 3 decades when it was truly 20 minutes to get anywhere. But you still have to obey the speed limit And remember, there are so many families that are now out walking, individuals who are getting exercise. Please watch the road and obey all the speed limits. And our LAPD officers will be out there ticketing people who are speeding because you're putting people's lives at risk. We also are looking at pedestrian safety and making sure that COVID-19 doesn't spread. This takes intense work, but we've already started downtown in some of the most pedestrianized areas, soon in MacArthur Park and Hollywood, and we'll go from there, where we're turning on the pedestrian lights and signals automatically so that you don't have to touch that yourself, so that people aren't repeatedly in the same place potentially passing on COVID-19 to anybody else, and that people can enjoy the walk in their neighborhood. With that, let me now move on to several announcements on enforcement. My Safer at Home emergency order requires Los Angeles residents to stay in their homes. It limits all outdoor activities to minimal exercise and what is absolutely necessary, and closes non-essential businesses that require workers to be present in person. Since I announced that order nearly 2 weeks ago, we've taken additional steps to strengthen physical distancing as much and to cut gatherings back as well. Most Angelenos have heeded this call, but some have not, and that's a problem. Folks were gathering at the beach, so together with the county and the state, we shut the beaches down. Too many people were too close on courts and fields, at recreation at park facilities, as well as those on our trails, so we closed those too. And this past weekend, some of our farmers markets became too crowded. As much as we love them, we just cannot take any chances with this virus. So tonight I'm announcing the temporary suspension of all farmers markets in the city of Los Angeles. Now, this is a little different than the other ones because food is essential, and I don't want the closing of farmers markets to have even bigger crowds at our grocery stores. I'm now going to require that all farmers markets submit plans immediately to our city's Bureau of Street Services that enforce physical distancing and ensure safe operations. Most likely it will be one entrance, one exit. People safely lined up with safe distance to get in. And of course, as we've done, the stopping of other things that are not essential, like crafts or prepared foods. We want people to be able to eat well. We want people to get access to food, but we can't risk the spread of this disease. So all farmers markets are suspended until they come to the city, show us that plan, and we will monitor that to ensure, just as we're doing at grocery stores and other places, that people are not spreading this disease. We know that our food supply is vital, and if our farmers markets submit their safe operations plan starting tonight, our Bureau of Street Services will look at them immediately, and they will be able to continue operating later in this week. But we need to suspend this right away until we can get this under control. And I would ask not only the farmers markets to do their part, but all of us. If there are too many people, simply wait before you go in. Additionally, we had to shut down another park, a meadow at the Silver Lake Meadow, one that I loved because when I was a council member, helped create it, and it is one of the most beautiful vistas after this crisis. I hope all of you get the chance to see if you never have. But it was a popular park that became too crowded to be safe this past weekend. And today, the Los Angeles Police Department visited 46 non-essential businesses in our cities that last week resisted closing down. And if they continue to operate, they will be referred for prosecution to our city attorney. I know our hiking trails, I know our beach, our iconic locations, the meadow at the Silver Lake Reservoir. These are cherished gathering points for all of our communities. But the more we abide by this, the sooner we can get back to them. The commitment that you make is a commitment to one another and ensures that more of us will be alive to be back there all together. I've said it before, but I'll say it again, stay at home. This is not a game where the city closes one venue and people chase and try to find the one that's open. This is just a moment to stay. Go for a walk around the block if you need to get out. But stay home, save a life. Don't take a family expedition to the grocery store. Send one person. Make sure that you're using your head, you're using your heart, because this is about saving lives. April 1st is fast approaching, and many Angelenos are rightfully concerned about paying the rent. Maybe you've had your hours cut, or you've been laid off, or you've tested positive for COVID-19 and you're unable to work. Well, I want you to know that the city is here to help you. I am here to help you. That's why today I signed the ordinance passed by the Los Angeles City Council on Friday, providing an emergency eviction moratorium for both residential and commercial tenants. If you cannot pay the rent as a result of this emergency, you cannot be evicted. Since this legislation passed by the council is nearly identical to the language in my earlier emergency order, I'll be withdrawing that earlier order so there's no confusion, and all other emergency orders will remain in effect. The money owed by tenants won't magically disappear. Tenants still need to pay the rent if they can. And after this emergency ends, residential tenants now, thanks to the council action, will have 12 months to pay it back. Commercial tenants will have 3 to pay back their rent. And today I went further, executing an additional emergency order, suspending any new rental increases of residential units that fall under the rent stabilization ordinance, which is the great percentage of our units, RSO units they're called. Until today, rents in these units could be increased by up to 4% annually. But as of now, those increases are put on hold by this order until after this emergency period is over. And we're working with council members and others to close any loopholes so that tenants don't, the day after this crisis, suddenly find themselves evicted and out on the street. And I want to thank Mike Bonin and Mitch O'Farrell and, of course, our council president, Nuri Martinez, and the leadership of the city council to make sure that we find a solution while we also appeal to our state leaders to help us as well. Across Los Angeles, we have 624,000 rent-stabilized units in 118,000 different buildings. And tenants in these RSO units will not be subject to any rent increase. Rent will stay the same. This is a common sense action on top of the eviction moratorium that will help folks stay in their homes and make ends meet. Every day, through the fear and the uncertainty of this moment, we see how this crisis is bringing out the best in us. I know it's tough, but I see you. I read the stories. I see the pictures. Folks are reaching out all the time to do more, and the generosity, kindness, and determination embodies our Angelino spirit. Yesterday, we witnessed that spirit in full force as we announced the support of some of LA's leaders for the Mayor's Fund for Los Angeles to get money to those who need it, to help our healthcare workers have childcare, and to make sure that our seniors are fed. And each donation that's been given are reminders of those angels in this city of angels. And today we can add 2 more angels to that list, Martha and Bruce Karsh. Together, Martha and Bruce Karsh are giving $1 million to the Mayor's Fund to help with critical needs such as that meal delivery for isolated seniors and vulnerable Angelinos, as well as the child care for healthcare workers. From education to social services, medical research, and mental health care, Martha, Bruce, and their family usually give quietly, directing their tzedakah, their charity and commitment, to the pursuit of justice without attention or acclaim. But I asked them if I could say their names tonight, in hopes that it spurs others to step up and join this incredibly generous offer. With this commitment, our crisis fund is closing in on $10 million for those left behind by federal legislation, for those who can't wait for the help that they need, and for our healthcare workers who need to show up at work every day to help save our lives. $10 million is a milestone for the Angelino Fund, not an end goal, so we're going to continue asking you to go to mayorsfundla.org to help your neighbors, your grocery workers, our first responders, the households that need us, those who've been knocked down by the economic blow of this crisis. We see it from Andrew in Brentwood, who gave $5, or Erica in Playa Vista, who gave $25 because she said, quote, she wanted to make a difference locally for my community and support families that are the most in need. They both know every dollar makes a difference. And we see these commitments all around us from our labor community, our labor unions and leaders like Ron Herrera and the LA County Federation of Labor. Last Friday, they got members together at an IBEW, Electricians Training Center, to give out food and meals to more than 2,500 LA families. And they're going to continue to lead these food operations throughout the year and hope to host 5 more in the weeks ahead. They're also helping us organize volunteers to pitch in where we may need their help. whether it's standing up, what we're doing at the convention center, handing out food where we need, critical workers with critical skills at a critical time. So thank you to the working Angelenos who are part of this chapter and writing it together. That's the determination of our city, of our workers. And you know, in ordinary times, we would have taken today off. We would have celebrated the life of Cesar Chavez, Dolores Huerta, of those who stood up for all of our rights. You know, Cesar Chavez's life was one of persistence and perseverance and resilience. He brought these qualities to fight for all of us. In our same time, we are called in this chapter to do just that, to step up, to go further than our bodies might imagine, to go further than our hearts might have thought, and to use our heads and do what is right to make sure that this is not a sad chapter, but one in which we move towards the light. Cesar Chavez talked about that kind of empathy and service when he said that in giving of yourself, you will discover a whole new life full of meaning and love. LA love. I've been talking about that since the beginning of this crisis, and you've been feeling it even on your most scared days. But this is what we are doing today, giving of ourselves, our time, our space, our normal routine so that our city remains a place full of love, this LA love. So do everything you can to make sure that we do all that is possible during this crisis to make it as short as it can be, to soften the blow for those who are the hardest hit. And like I say every night, stay safe, stay healthy, and stay home. Strength and love, Los Angeles. I'll now take questions. Thank you. First question?
Our first question comes from the line of Mary Beth McDade from KTLA Channel 5 News. Please go ahead.
Hi, Mary Beth.
Hi, Mr. Mayor. Nice speaking with you. So earlier today, Dr. Galli, she said that the convention center is going to have patients who are likely COVID positive or expected to be COVID positive, who are ready to be discharged from the hospital but still need a few more days of care. She also said that the city is in charge of operating that hospital. So I'm just wondering, when is this going to be staffed and when is it going to be up and running?
Thank you for the question. Yes, we offered the convention center to hospitals, to the county, to anybody in the medical community who could use this, knowing that we needed spaces and we needed beds. And based on their advice, they said, please do go forward. We received 250 beds from HHS, Health and Human Services, the federal level. We're looking at other ways to build that out. But we really see this as a collaborative place and space, and we'll take the direction from the county. Initially, it was going to be for non-COVID-19 patients. Now they're asking whether it can be for COVID-19 patients who have lower acuity and the symptoms have either relaxed or not gotten intense. But I do hope that they will help us. We are doing an all-hands call. As I've talked about the last few nights, we have over 3,000 now medical professionals who volunteered to help. We're going to draw from that. Today, we formally requested the Department of Defense's assistance with that facility, and I spoke with Senator Kamala Harris about that, and she's going to reinforce that with DOD. But we don't run hospitals, so any help that we can get, obviously, is one that we would very much value, both from the county, which has health expertise, and we'll continue talking to them and getting their advice, and from those who might have been recently retired or who are not working. So we're continuing to build that space out every single day. We have a little bit of time to get that done right now because of the availability of beds. As we look at them, there's still about 1,500 beds available. But we know that when that surge will come in a week or 2 or 3, we better be ready. So I wrote a letter today to Catherine Barger asking for the county's assistance in some of the medical side. We'll try to take care of everything else. And if we can't get that assistance, we'll scramble and figure out how we can build a hospital for the first time or a field facility, as it's being formally called, in the convention center to help save lives. Thanks. Next question.
You, and now to the line of Alex Michelson from Fox 11 News.
Hey, Alex.
Go ahead.
Hi, Mayor. Thank you so much for taking our call.
Of course.
I I've talked to a lot of Angelenos who are concerned about an issue you brought up tonight, this idea that they're grateful to have this moratorium on the rent, but we're concerned about the idea of paying it back after several months of not working. Can you give us some more details on this year extension or 3-month extension, how exactly that would work, how much people have to pay back to sort of ease people's fears?
Absolutely. So this is not a 3-month for residential evictions or for renters, I should just say. It's 12 months. For commercial tenants, it's 3 months right now. That's what was passed by the City Council. I had initially, in the first days, made sure that people could have this moratorium so they didn't have to be stressed. They'd be evicted in the midst of a crisis where we are requiring them to stay home. And I fully support that extension from 6 to 12 months so that people can, over time, pay a little bit back and make sure. There will be negotiations, obviously, between landlords and tenants. And the most important thing to remember is not to just ignore landlords, too, who, if they lose your apartment, that doesn't mean that you're going to be better off. We need the banks to be supported, to be able to support the landowners, to support the renters. But we think the best place to start is with the great majority of folks who right now are living under a lot of fear. And the second point I made, there's a lot of fear too that an eviction notice could go out, and the day that this is lifted, then people could be evicted when the courts are back in. We are looking at any legal way to fix that. The state is also looking at that as well. But let me be clear. Landlords cannot evict people during this, and tenants will have an entire year to figure out the payment of that. And that is, I think, the most generous of any place in the country right now, and I'm proud that LA is leading. Next question, thank you.
Thank you, and now to the line of Steve Gregory from KFI Radio.
Hey,
Please
Steve.
go ahead.
Mr. Mayor, good evening.
Good evening.
Quickly, the report you were talking about last night on the call with Loyola Marymount, when is that going to be available publicly?
Sure.
When can we kind of take a look at that report? Also, with respect to homeless encampments, I have been driving around to sort of get a sense of how things are going, and I'm noticing particular homeless encampments that have been in pockets of LA for quite some time. Are those task forces that you have, are they going out to these people? Because obviously they're not adhering to any social distancing. And how are you treating those individuals?
Sure. So for unhoused Angelenos that are homeless, folks have been working for weeks, outreach workers and others, letting people know not only about COVID-19 coming, but the options. A lot of hesitation the first couple days, but once the word spread on the street, as I said, every place we've opened now, they're more than 95% full. 13 more of those will be open this week, and it's not just the shelters, and people are screened before they go in them, it's also the hotel and motel rooms as well. Out on the street, we are continuing to push on testing and trying to figure out the capacity of letting people know that they can get a test if they have symptoms. That will be up and running this week in Skid Row and through a lot of the community clinics that serve homeless Angelenos too, because that's absolutely critical. And then, of course, as I mentioned, the isolation either in a hotel room or in the trailers that we have. Out on the street, it is the instructions for folks who do, for LASA and others, to tell people not just about 6 feet, but 12 feet is the standard. Obviously, we have in Los Angeles County some 60,000 people who are homeless. So you're not going to find 100% perfection out there, but it absolutely is a priority, needs to be a priority. And for all the Homeless Service Authority outreach workers that are out there helping and public health workers, that is something they're going through and letting people know. But I think you're right, there's not 100% adherence out there, and that worries me greatly. So we'll work together. This is not something where a law enforcement approach works best, but people need to have enough folks out there to let people know this could kill you. This could spread, especially in some place like Skid Row, where now we're putting together plans for how we surge people if there are not just 1 or 2 people in an encampment or a dozen, but what if we have to move hundreds of people quickly and how we can get them someplace safe. And then the first question was, remind me? Steve, you still there? I think you had one other question before. My apologies, I'll come back to it. You just get on the queue if you need to. I'll go to the next one.
Okay.
All right, thank you. And now to the line of Robert Kovacek from NBC. Please
Hey, Robert.
go ahead.
How are you, Mayor?
I'm hanging in there. How you doing?
All right, sir, thank you. The study out of the University of Washington today, I would like to ask you about that. The study from the Institute for Health Metrics and Evaluation projects that for the state of California, the virus will peak in late April, deaths will max out at 100 per day before the pandemic is largely over by the end of May. Is this study consistent with what you're being told for Los Angeles?
Yes, Dr. Paul Simon is embedded part of the day here with our city team from our Department of Public Health, and he oversees all the research studies there. A great doctor and an integral part of the team that we have here, as well as the team that Dr. Barbara Ferrer leads. He said that the University of Washington study is one of the most rigorous. It's one of the best research teams. There's another one that's ongoing with Harvard University. I think there's 11 different ones. So you're going to hear some different dates. If you change a little bit of input, like for instance something called the R naught, what that means just is how many people does the average person infect? It's a symbol, R with a little 0. Right now, the best estimates of this are 2.5. Every one person who gets this infects another 2.5. Start doing the math and you see how this spreads like wildfire. But if social, or as I call it, physical distancing, allows us to have more space from each other, and that R naught goes down to 2 or 1.9, that's what flattening the curve is all about. And we want to get to an R naught that's less than 1. When each person is infecting less than one person, then you can actually see the disease starting to die away, or the virus starting to die away. So the University of Washington study is very rigorous. It's not the only thing. I wouldn't take any of these numbers as gospel. These are projections that help us plan for beds, help us plan for what we're going to have to do, help us plan for how long this is going to take. But I do think it is one of the ones that has credibility and accuracy when I've talked to experts. Second, I remembered what the previous first question was, which was the Loyola Marymount study as well. And we're working with a lot of different academic institutions, and I want to thank the Center for the Study of Los Angeles. They allowed me to share some of that because they gave me the briefing over the weekend on the initial calls they've made. But that was, I think, some 600 of over 2,000 calls they're going to make. So they will, at the end of that period, release it to everybody. But as I get that data, they said it was fine checking in with them and sharing that, because some of that data is so important to know. For instance, before yesterday, I didn't know that 1 out of 3 homes had somebody with a pre-existing medical condition in it already. That 1 out of 3 homes had somebody 65 or over in it. So you put those together, nearly 2/3, or maybe there's some overlap, but probably more than half of our homes already have somebody vulnerable, which is why it's so important to isolate when you get sick and not just say the whole family is going to get sick. In that study, too, we learned that 20% in the initial respondents, 20% of people don't have a friend or a family member to care for them, to look after them if something happens, which is why it's so important for us to be checking in with our neighbors or that person that we know who lives alone and maybe doesn't have somebody who can care for them should he or she get sick. So the LMU stuff I think is going to be available in mid-April, they said, or maybe second week of April, because they're still calling a lot of people, but I'll keep sharing that data as I get it. Thanks. Next question.
Thank you. We do have a follow-up from Steve Gregory of KFI Radio.
Sure.
Please go ahead, sir.
Mr. Mayor, I believe I think you just answered that to Mr.
Okay.
Kovacic about the Loyola Marymount test that
Yeah.
you said, or test, excuse me, report. You said that would be available mid-April?
Yeah, I'll get you the date specifically. I think they told me yesterday, but I don't remember. I think it was April 12th or 16th. I think it was right
Do you
around
have
there.
any more details from that to share tonight?
I don't, but I'll share some more tomorrow. I don't have it with me. I mean, there was very interesting details about the support. I'll tell you one thing that I might not have said last night. Forgive me if I'm repeating, but 95% of people supported stay at home. I mean, I don't know when 95% of people agree on anything, including sunshine in Los Angeles. That's remarkable. I'm proud of our city. It shows that that piece is working, that people believe in this, and they're trying to do everything. My role each night is to let you know how you can do just a little bit more, or how you can crack down on places where we still have leakage. But I'll look for some more stats and see what we can bring in tomorrow, okay?
Okay, thank you, sir.
Thank you. Next question.
Thank you. And we now go to the line of Jeff Taylor from Bloomberg's News. Please
Hey,
go
Jeff.
ahead.
How you doing?
Hi, Mr. Mayor. Thanks a lot for taking our question.
You bet.
My question is it's a political question, I guess you'd say, but it's also a policy question. Do you sense in this crisis a fertile environment for progressive ideas. By that I mean, when the federal stimulus bill was passed, it contained a lot of things that might have been politically unapproachable a few months ago, such as very generous unemployment benefits for people laid off during the crisis, including independent contractors like ride-sharing drivers. I mean, in this environment, could you see and embrace progressive ideas like universal health care coverage, universal basic income, greater fund, maybe on the local level and the state level, greater funding for mental health care for the homeless? Is this an environment in which progressive ideas can flourish?
I sure hope so, though I think our focus is getting through this crisis right now. But one thing this crisis has shown us as a nation is not only our weakness when it comes to fighting pandemics, and that we have no even limited national healthcare system to just even stockpile the proper number of ventilators and have masks for medical personnel who are now dying as a result of that. It also underscores for me the weakness of many parts of our economic system. And while we can celebrate the Dow Jones, that doesn't mean much to somebody who's barely skating by in a gig economy with no benefits. And when something like this happens, we've been saying it, how many years have we said that big percentage of Americans, over 50% of them, are one accident away, one medical emergency away, one layoff away from losing everything. Well, now we're seeing it. So I do hope that it's not just about progressive ideas, it's about actually caring for each other. American exceptionalism can't just be that we don't care about each other. It must be that we do put in place something to catch folks so that we don't have homeless on our streets, so that we don't have ventilators missing from our national stockpiles. We need to think as a nation, not just as a country, and not just brag about our heights, but go down into our depths and take those people off of our skid rows, protect people who work hard so they can have a decent retirement and decent health care. And I hope that what will come out of this is not that that is a left, right, or a Democratic and a Republican thing, but that it is an American thing and a progressive thing, yes, for the progress this nation needs to see. Otherwise, we could be back here again. It might not be COVID next time. It could be some other shock to the system, a small recession. But this is too high a price to pay economically while we're just trying to save lives on the health side. Thanks for the question.
You said we need to think as a nation instead of as a country and not just brag about our what? I missed that word.
Brag about our heights. Like there's no question that we do some of the most amazing things in the world. We, shoot ships into space. Our military is unmatched. Our movies are incredible. But we also need to judge ourselves by folks who are hungry and who are homeless and who are on the edge and without health care and addicted to drugs. That also is the measure of a nation being the people and the country being the state. It is time for us to think of ourselves as one people again. Thank you. Next question.
Thank you, and that comes from Claudia Pashuta from KNX Radio. Please go ahead.
Hi, Claudia.
Hi, Eric. Public Health today talked about 2 confirmed cases in the homeless population and a case of somebody who works in a shelter. I'm just wondering if you foresee any point soon where testing ramps up to the point that it could actually be happening within encampments on the streets, because despite all the efforts that are being made to shelter the people who are on the streets, chances are many are going to remain out there, and just wondering if there's going to be any sort of way to track cases on the street.
Absolutely. So we're starting that this week through street-level clinics. So it still requires somebody to come there, but a lot of those doctors also go out and do work on the streets, so they may be able to actually start testing on the streets this week. We're looking at Wednesday, the UPS sponsored tests that we talked about that we are buying, but they're paying for all the transportation of with Everlywell. Those ones will be focused on our seniors and on our homeless Angelenos. And it allows us to drop those off at places that already have medical professionals, because most tests are not self-administered yet, and then we can get the first batch in. I hope that when we have some of the new generation of tests come online, that this will be a priority. There are some that we've all read about and that we've all followed. It could be 15 minutes, blood test, a little pinprick on the streets. Right now there's some questions about too many false positives in there, But if we are able to do that literally on the street, my first priority would be, of course, for those who have no place to go, who are both vulnerable and susceptible. Vulnerable because they're on the streets, and susceptible because they often have underlying medical conditions and are more likely to die than others. So I'm excited that we're finally getting that. When we talked about testing, I said early on, please can we figure out whether it's through the county, whether it's through our hospitals, whoever, can we get some testing for homeless Angelenos? And we've just kind of taken the bull by the horns, and we're going to be continuing to work. I think it's with 4 different clinics and 5 different organizations just on Skid Row alone to do that testing. Thanks, Claudia. Next question, please.
Thank you. And now to the line of Bob Jablan from Associated Press. Please go ahead.
Hey, Bob.
Hi. Thanks, Mr. Mayor. You had mentioned last week that you were expecting the virus outbreak to peak in LA maybe this week, maybe in a couple of weeks. I'm sure you're aware the county is looking at late April as their estimate, and the state is looking at mid-May. I just wondered if you're still holding to that as your, as your peak belief.
I didn't see it peaking now. I said we'd be probably where New York was around, I guess that was a week ago, in 1 or 2 weeks' time. But in terms of an overall peak, no, I think we've always been looking at that and told everybody that would be in April, if not May. It's really difficult to predict these things. I've also said we wouldn't know for about 10 days what effect the social distancing would have, but a peak is different than flattening the curve. We may start to flatten a curve, I hope, through everything that we are doing, but that is just on the rate of increase. If you look at the pure number, it'll still be going up to a peak. A peak comes much later than the flattening of the curve. So 2 things for people to be prepared about, and I've been thinking about doing maybe just 1 session on all of this to try to explain just in plain English to everybody so we can all prepare ourselves for what comes next. We follow 3 things. The absolute number of cases that there are and deaths each day, and you see those in a linear line, and you see them accelerating up because, as you can imagine, a bigger number of people infecting a bigger number gets you a higher and higher number. Second is the rate of increase. Just because that number continues to go up doesn't mean that the rate of increase is doubling faster and faster and faster. In fact, last 4 days, for instance, were lower than last week when we had a 52% increase in a single day. Those are good signs, but you can't just look at 4 days. You have to look at a few weeks to know. And then the third thing that we need to look at is not just the rate of increase, but when is the actual peak in cases, because that's what affects the hospitals. A hospital bed count doesn't care about that it's slowing. At the highest point with the most people infected who require hospitalization, that's when we will be the most taxed. So we have to follow all 3 things. When will the most beds be needed? Are we having any success in slowing the rate? And how many overall cases do we have? I hope that's helpful. Next question.
Thank you. And again, if you'd like to ask a question, please press 1, then 0. And now to the line of Carla Hall from the Los Angeles Times. Please
Hi, Carla.
Hi, Mayor. You just mentioned that you're going to suspend farmers markets in the city until they submit plans for how they could safely operate.
Yep.
Do you know if other neighboring cities are going to issue guidance like that? And would you issue some kind of guidance or constraints on food trucks and delivery services in the city?
Absolutely. I think it's something that we're always getting advice from public health. I spoke just before this press conference with Catherine Barger, with Robert Garcia, the mayor of Long Beach, and they're struggling with the same things. And I think we all would like to see food access, whether it's in a grocery store or a farmer's market, stay protected. That is critical for all of us. And we want to make sure that we have farmers markets that do. And we do see some, even in the city of LA, that are adhering to this. I think they probably will be able to show that plan. They do a good job of enforcing that distance. They let people in and folks line up. But we need to have that across the board, because one farmer's market that isn't run the right way can be a super spreader. Just like we saw initially at the beginning with grocery stores, and we said, people, stop making a run on the grocery stores, it's not only bad for people's food access, it's also causing unsafe environments. So yes, we're talking across the county about this, constantly talking with public health. And this is a little different than completely shutting down a park or a beach. These are local farmers, folks' livelihood, who are providing us with food. And if we can do that in a safe way, we will figure out a way to move forward. But until then, we're suspending.
Okay,
Thanks.
thanks.
Thank you, Carla. Next question?
Thank you. Our final question in English comes from the line of Jintak Han from the UCLA Daily Bruin. Please
Hey,
go
Daily
ahead.
Bruin. Hey, Jintak, how you doing?
Hi, Mayor. Thanks for taking my question.
You bet.
I want to pivot back to the issue of homelessness.
Yes.
I've been seeing some people on the streets reject shelter housing at these recreation centers because they raised issue with sanitation. They saw workers not sanitizing their hands, the facilities lacking proper ventilation, and they felt less safe in the shelters and felt safer on the streets. How do you plan to protect those on the streets and shelter them when they don't feel safe in these shelters? And can the city ensure the shelters and the workers there practice proper sanitation?
Sure. You may have found some people who say that. We've had a ton of folks who are actually saying the opposite, that are saying this feels safer, cleaner, I'm off the streets. And if you have any particular ones, we're always happy to follow on to see, as folks came in, whether there was some screws to tighten up. That said, it is probably one of the most religious protocol places now in the city, one of the safest places to be. It's one of the few spaces where people, unlike out on the street, are screened so they don't have symptoms before they come in. If anybody develops symptoms, we have a place to put them right away. That doesn't happen on the street as well. We have showers in all the rec centers, and the new ones this week, we have shower contracts to make sure that folks will be able to have portable showers at least every couple days, if not every day. And personal protective equipment for many of the workers who are directly engaging, and we're surging that in as well. So we want these to be not only among the safest, cleanest, but I think the proof is in the pudding. If they were 30% filled, I would say we're doing something wrong, but we're over 95% filled. But always happy if you want to pass on through my press deputy any particulars at any particular place. We'll make sure we always investigate that, tighten that up, and make sure that happens. Thank you.
Thank you.
Okay. Thank you. I'm going to say some words in Spanish and take some Spanish questions as well. So I know some of the Spanish channels need a second to get ready, but we'll do it 3, 2, 1. Buenas tardes, Los Ángeles. Hoy empezamos otra semana crítica en nuestra lucha contra la propagación del coronavirus en nuestra ciudad. Y si hay una cosa que quisiera que recuerden, es esto. Entre más acción tomemos, más pronto llegaremos al final. Al contrario, si hacemos menos, el final está más lejos. Hoy, en el condado de Los Ángeles, hay 342 nuevos casos positivos de coronavirus, llegando a 2,474 casos en total en el condado. En la ciudad de Los Ángeles hay 151 nuevos casos positivos, llegando a 1,171 casos positivos en total en la ciudad. Además, fallecieron 7 personas más en el condado, llegando a 44 fallecidos. Para los que han perdido a un ser querido, les doy mi más sentido pésame. Continuamos trabajando para ampliar nuestra capacidad para ofrecer pruebas de detección gratis. Hemos hecho 8,373 pruebas. Al final de esta semana, habremos hecho 13,000. Hoy abriremos el 5º sitio para ofrecer pruebas. Tenemos miles de citas para ofrecer gratis. Por favor, visite la página coronavirus.lacity.org para ver si eres elegible para una prueba. Estamos haciendo todo lo posible para proteger a nuestros residentes. Abrimos 13 refugios de emergencia para personas sin hogar y tenemos 900 habitaciones en hoteles para personas en cuarentena. Si algún hotel o motel quiere ofrecer sus habitaciones durante esta crisis, por favor visiten la página coronavirus.lacity.org/rooms. También contamos con 42 casas rodantes en Westwood y tenemos 27 más que pronto llegarán a Granada Hills en el Valle de San Fernando. Estas casas rodantes son críticas para proteger a nuestros vecinos sin hogar y a todos nosotros durante esta crisis. Además, hemos visto que desde que anuncié la orden de emergencia Más Protegidos en Casa, la cual requiere que todos se queden en casa, no todos han cumplido con esta orden. Este fin de semana vimos que había demasiada gente en los mercados de agricultores. Esta noche estoy anunciando la suspensión de estos mercados durante todos los días de la semana mientras recibimos un plan de ello sobre cómo mantener las sanas distancias en todos los mercados. Además, el Departamento de Agua y Energía ha cerrado la pradera en Silver Lake. Les recuerdo que lo más pronto que se comprometen a quedarse en casa, lo más pronto se acabará todo esto y podremos regresar a disfrutar de nuestra bella ciudad. Quédense en casa. Si no lo hacen, hay vidas en riesgo y puede ser la suya. Con el 1 de abril que llega, les recuerdo que yo firmé una moratoria de desalojos para residencias y espacios comerciales. Si no pueden pagar la renta a causa de esta crisis, no los pueden desalojar. Pero su deuda no se va a desaparecer. Cuando se acabe esta crisis tendrán 12 meses para pagar su renta atrasada. Y da una asistencia, ayuda a los inquilinos de Los Ángeles por el próximo año. Además, hoy di un orden de emergencia para parar el aumento de renta de unidades bajo la ordenanza de control de renta. Continuamos recibiendo también donaciones generosas de angelinos que lo pueden hacer. Le pedimos que si pueden donar, por favor, visiten la página web mayorsfundla.org para ayudar a sus vecinos. El espíritu de nuestra ciudad, el espíritu de generosidad de Los Ángeles, continúa todos los días. El viernes vimos un grupo de sindicatos unirse para ofrecer despensas para más de 2,500 familias. Esta es la fuerza de los sindicatos. Normalmente estaríamos celebrando el legado de César Chávez, un héroe de nuestra comunidad. Él, junto con Dolores Huerta y los trabajadores agrícolas, era un ejemplo de resiliencia y dedicación en la lucha contra la injusticia. Ellos dicen, se puede, sí se puede, pero muchas veces nos sentimos que no se puede. Pero es mi mensaje esta noche con este legado de César Chávez, a recordar la fortaleza de nuestra gente, la fortaleza de nuestra ciudad, la fortaleza de Los Ángeles. Es lo que hacemos hoy. Sacrificamos nuestro tiempo, nuestros espacios, nuestros rutinos para hacer que nuestra ciudad continúe siendo un lugar lleno de amor. Entonces, amigos, quédense protegidos, quédense en buena salud, quédense en casa. Muchísimas gracias. Fortaleza y amor, Los Ángeles. Preguntas. Gracias. Preguntas en español? Questions for our operator?
We have a question from Leon Krove from Univision. Please go ahead.
Hola, Leon.
Hola, alcalde, le saludo desde los estudios de Univisión 34. Miles de angelinos deberán pagar la renta pasado mañana, el 1 de abril. Todos los días Univisión recibe llamadas de gente angustiada por no poder cubrir esa renta. ¿Qué debe decirle a su casero una persona que no pueda cubrir la renta pasado mañana? Específicamente, ¿qué explicación le debe dar esa persona a su casero? ¿Qué debe decirle?
Sí, hay un moratorio de desalojos para todos los residentes. Y es importante recordar que este es tu derecho. Si usted tiene un dueño que no entiende la ley, llama a 311 y nuestro departamento de la vivienda pueden dar a él la información, porque no pueden tener un desalojo durante esta crisis y usted tiene 12 meses a pagar su renta durante este tiempo. Si tú puedes pagar su renta, tu renta, por favor, págala. Pero por toda la otra gente que no pueden, es tu derecho y la ciudad de Los Ángeles defenderá sus derechos. Gracias, León.
Alcalde Garcetti, ahí está lo que nos decía con toda claridad, ya lo hemos explicado, pero ahora lo dice el alcalde de viva voz. No hay en absoluto ninguna obligación de pagar la renta. Si usted no puede, en caso tiene que entenderlo por ley, tiene que entenderlo, si no, comuníquese al 311.
Sí, hay una obligación, pero no hay desalojos. A este punto no hay una vacación de las rentas, pero tenemos una política más generosa en los Estados Unidos ahora, a prevenir la evicción, a prevenir estas acciones contra nuestras familias. Pero para más información, llámanos a 311 y nosotros podemos asistirte con sus dueños. Y hay un programa también por la vivienda pública con el gobierno federal, también es el mismo, para prevenir evicciones en la vivienda pública en partes de Los Ángeles y todas partes de los Estados Unidos. Sorry, I think we're having a little bit of feedback issues. We will work on that. Discúlpame, pero gracias por las preguntas. Continuaremos mañana. Thank you all so much again for tuning in. Thank you, Leon. Gracias a Leon and the others. I'm sorry if we couldn't get to the question today, but we will tomorrow. Strength and love, everybody. Thank you.